Hi, my name is Jenna Evans. I'm a member of the coding education team and work specifically with the IM Specialties pod, of which endocrinology falls under. I have 30 years of experience in medical records, or the fancy name health information management, and I always tell providers that documentation is really truly your best friend. Accurately documenting the care provided supports your coding and billing, and just as important, it is your best friend if you ever have a lawsuit and find yourself in court. So take some time to assess your documentation skills, and if you have questions, myself or another member of our coding education team can help you. As you're aware, we've made it through our first year with ICD10. On October 1, we'll have new coding updates for I-10 that go into effect. So as we prepare for this, what can you do as a provider? So many of you are probably aware that for this past year, we've actually had from Medicaid where they were not accepting unspecified codes. Medicare had a hold on that, and they've waited for this first year grace period to go by, and we will see on October 1 that Medicare will be very select in the codes they accept also. So we really need to start gearing away from the unspecifieds. So it's quickly approaching now to September 30th when we'll turn to October 1, and what can we now expect for you to document? So the important thing is for you to remember that you really need to code to the highest level of specificity based on the information you have available at the time treating the patient. So like I said, documenting to the highest level of specificity. So for instance, you have a patient that might be referred to endocrinology, and you're really not sure exactly their exact problems, but just document to the highest level. If it's just pre-diabetes, you would document that until you have all your lab work and other tests back and can document that the patient truly has diabetes, for instance, as an example. Or if something is probable or suspected, you code that sign or symptom until you can make a definitive diagnosis. Also documenting cause and effect relationships, and also linking complications to chronic conditions. We've seen a lot of changes between the world of I-9 and I-10 codes. There were some codes in I-9 that you only had to have one code, and it now requires two in I-10, or perhaps just the reverse, two in I-9 and one in I-10. But it is important that we capture all of those codes. Also, make sure when you are treating and assessing a patient and dictating your note and do your documentation and your assessment and plan, list anything that you assessed or treated in that impression and plan. For instance, if you have a patient come in and they have diabetes and you also know they have chronic kidney disease, you may not be treating that chronic kidney disease, but it might be something that you actually take into consideration as you're assessing that diabetes. And if that's the case, it's very important for you to make sure both of those are in your impression and plan and that you get credit for everything you are assessing with that patient. Also, many of you are probably very familiar with the problem list in EMR. Keep that up to date. Look and see when you have a new patient or you even have a patient returning for follow-up visits. Check to see if the diagnoses you're putting in your assessment and plan or your impression and plan are a part of that problem list. It's very important that we have those current. You can also mark things as inactive if it's no longer accurate for that patient. So as we move past this, and I'm going to spend a few minutes talking specifically about the new codes for endocrinology in Chapter 4, the Endocrine, Nutritional, and Metabolic Diseases chapter. There are actually over 350 new codes in this chapter, but before you gasp and think, wow, how am I ever going to learn these, it's really going to be a lot easier for you than you think. Because in the world of I-10, when they came out, they brought I-10 out, and one of the big things they pushed was having a lot of laterality for left, right, bilateral, and unspecified. Well, strangely enough, last year when that came out, they really didn't have much for ophthalmology, and obviously you have a left eye, a right eye, or it could be both eyes, or perhaps unspecified. So this is where you're really going to see the biggest changes here in your diabetes section. There's several subcategories for codes specific to diabetes with ophthalmic complications, and they now have a new 7th digit specification. So for those of you that are very familiar with these, you'll recognize these. These subcategories include diabetes due to underlying conditions, drug or chemical-induced diabetes, type 1 diabetes, type 2 diabetes, or other specified diabetes. And the one thing that all of these have in common is once you get past the first category codes, which are like E08, E09, E10, E11, E13, you have your decimal and the 0.3. And that fourth digit actually means the ophthalmic complication. So then we'll look here, and you'll be able to see these will look very familiar to you. You would then have the fifth and sixth digits on each of those codes we talked about, delineating was it non-proliferative or proliferative, and then you'd have all these little bullet points you see under each one where you specify that. All of that's something you have right now. None of that is new in our new world with our changes going into effect on October 1. What is new is you can now actually build these codes and add a seventh digit so that you can specify right, left, bilateral, or unspecified. And you'll actually see that seventh digit code in the parentheses, a 1 for right, 2 for left, 3 for bilateral, or a 9 for unspecified. So that's the biggest change with all of those codes. If you think about all the possibilities of those codes, that is probably a couple of hundred of the codes right there. Also, another area where they have added the laterality are these codes where you have diabetes for resolution following treatment. And here again, these are those exact same categories we just discussed. The diabetes due to the underlying condition, the drug or chemical induced diabetes, then also type 1 or type 2 and other specified diabetes. So the only change with these codes is you can now also specify right, left, bilateral, or unspecified. Now I do want to point out to you, and I'll use the second bullet on this page as an example, type 2 diabetes with diabetic macular edema resolved following treatment, and then you can specify the I. These series of codes for the ones following treatment have one characteristic in that the sixth digit is actually an X. And if you remember, the X is a placeholder. So for this particular one, for the type 2 diabetes, you would have E10.37X, and if it was the right eye, you would put a 1. So keep in mind, you must have that placeholder of the X in the sixth digit slot for those this time. A few other new codes that we have here in Chapter 4, specifically that we relate to you, are the pure hypercholesterolemia. It now has greater specificity. They've broken that down into two separate codes. You have the pure hypercholesterolemia unspecified, and you'll see a few things underneath it that fall into that, and then the familial hypercholesterolemia. So those are two choices there. And also when documenting cystic fibrosis, you need to remember that you would also document the exocrine pancreatic insufficiency if present. A few other revisions that we've seen, and these seem to be throughout many chapters in the I-10 release coming out October 1, is they had a lot of post-procedural hemorrhage and hematoma codes, varying organ systems. So here you see the post-procedural hemorrhage and hematoma of an endocrine system organ or structure following an endocrine system procedure. You'll actually see and hematoma marked out. And the same thing on the second bullet. So those would stand without the words hematoma. But as I go to the next slide here, you'll see that they also have a few additions now. And it's the same in all the other chapters also. You'll see that they've added one specifically for post-procedural hematoma, whether it's following an endocrine system procedure or another procedure, and the same thing for post-procedural seromas. So those are 4 new codes right there that they've added. Also a few other things just to be aware of. In the world of I-9, we had a code for prediabetes. And in the world of I-10 last year, it came out and we did not have a code. It was just abnormal glucose, and they had the prediabetes fall under that. Well, this year on October 1, they brought the prediabetes back as a separate code, so you have that one. It'll be R73.03. So if it's just an abnormal glucose and you don't want to specify prediabetes, there is the separate code that is current right now, the R73.09. Also in terms of hypertension, they had a big change with I-10 in that they really only had one specific code for essential primary hypertension, and that was I-10. This year they're now bringing out 3 new codes that fall into the I-16 category of hypertensive urgency, hypertensive emergency, and hypertensive crisis unspecified. Again, like I said, those are in the I-16 category with a different 4th digit for each of those. Also, there is a new code for family history of familial hypercholesterolemia, and that's actually a Z code that you can use. A couple of other Z codes just to bring to your attention. You're familiar with the category for the long-term current drug therapy. It is a Z code. That category is Z79 right now. So now they've actually added a new one. You will still have the other long-term current drug therapy, but they've also added long-term current use of oral hypoglycemic drugs. So that's a new code they've added in. And if you'll notice that it also says there's an excludes to note that you can also code the long-term current use of insulin. So you could have two codes possibly on a chart for that. And notice under the oral hypoglycemic drugs, they also give you a different descriptor also to include long-term current use of oral antibiotic drugs. So that's a very quick high-level overview of the codes for the Chapter 4, for the endocrine chapter, with a few others that I think will affect you in endocrinology. Should you have any questions about this information, or if I can help you with documentation or look at notes in any way, please don't hesitate to contact me. My contact information is here. I can be reached by email, or feel free to give me a phone call. Thank you so much for taking the time to watch our webinar today, and have a great day.